My name is Melissa Serta. I'm the director here at Southeast Mission Geriatric Clinic, SEMG for short, and we work here with the City and County of San Francisco, Department of Public Health. Yeah, so the goal of Southeast Mission Geriatric Services is to really identify and serve individuals 60 years and older who without mental health intervention and treatment are at risk of hospitalization or institutionalization. We're a part of the older adult system of care and provide comprehensive clinical case management and therapy to a caseload of clients meeting moderate to severe criteria for specialty mental health. And we're in an outpatient mental health setting. Our team here provides clinical case management, supportive therapy, medication support for individuals over the age of 60 who are experiencing severe mental illness, substance abuse, or other co-occurring medical challenges. We service the San Francisco neighborhoods of Mission, Bayview, Bernal Heights, Diamond Heights, Excelsior, Glen Park, Noe Valley, and Crocker Amazon District. Our staff here consists of psychiatric social workers, marriage and family therapists, psychiatrists, nurse practitioners, and a health worker. Yeah, so some typical duties would include clinical case management, having some open conversations with clients about their struggles, whether that's financially, medically, socially, and helping them get connected to the resources they need in the community. Trainees will also do a lot of talk therapy for clients who need that type of support. As we know, a lot of our older adult population have suffered a lot through the pandemic and experienced a lot of isolation, uh, death of loved ones, loss of independence and community. So there's a lot of grief and loss and processing those various challenges and struggles that they currently have. So there can be a lot to unpack. But the clients are so grateful and happy that someone's checking in on them and that they have someone to help support them through some of the confusing systems. There's also opportunities to host groups for clients that you know, yeah, so groups and other activities, we're really open to our trainees just utilizing or expanding on their areas of interest. As long as it's something that it is identified as an area of need and it's going to be beneficial to the clients and the community we serve, we're really open to, different types of groups that can get started here. Also working with our psychiatry team and supporting clients in connecting to their med staff and just communicating within an interdisciplinary team setting. So referrals typically go through myself, the clinic director at this time. We have a referral form that providers send in when clients are referred from their primary care doctor, the hospital, or even internally through our Department of Public Health Behavioral Health Access Center. We also take self referrals from clients as we go through some yeah, so we do take self referrals and we go through some standard assessment paperwork to get a full history. We make sure clients are eligible for our program. For example, if they have Medicare or Medi-Cal, we don't take private insurance, and we cannot work with clients who have a diagnosis of dementia. Uh, so we do have to do some of the screening to ensure that they meet a medical necessity. Um, we also don't take clients with very mild symptoms, as our focus is more for those with moderate to severe mental health needs. Um, so we may do referrals to some lower threshold therapeutic and case management services if a client needs to get referred elsewhere. But once we determine, a client is 60 years older, lives in our catchment area, has the correct coverage, and we've been able to review their medical records, we're able to complete their assessment and open up their case as a new client for us to serve. So caseloads will vary, and we really want to make sure that the experience is based on the trainee's comfort level and their experience, which of course will vary on a case by case basis. Caseloads typically start off small with a few clients and can be gradually increased, which is always discussed with the trainees first to assess, where they're at in terms of capacity and feeling if feeling like if they're ready for more cases. So it's really a collaborative process. Caseloads will technically be designated under myself and our PsyD, but we're the one, and that's because we're the ones technically liable for the clients, as students have to be under direct supervision of licensed staff to ensure compliance. But the trainees will have access to all of our systems and will input their own notes as care providers for clients in our electronic medical record system. Yeah, so supervision is held weekly, one-on-one individual sessions with myself. I'm in LCSW, or our trainees will be supervised by our dually licensed MFT and PsyD clinician. Her name is Francisca Oropesa. Yeah, so really training in the type of resources we offer. When you intern with the resources we offer and the type of services we offer, as well as learning our systems and things like that. But if you intern here with the Southeast Mission Geriatrics, you also get access to the trainings offered by the city and county of San Francisco. And of course, there's some standard onboarding trainings offered, but we also have a ton of online and on demand training available through our San Francisco Learning Catalog. We have trauma informed systems training. We have behavioral health system, Vimeo, and on demand trainings. We have, IT and Microsoft Office 365 and team support with free trainings classes led by Microsoft trainers. So really just a ton of various opportunities that are offered through the county. All trainees will have access to the same resources we have working through the Department of Public Health. So based on what they need and what they would like any additional specialized training in, we collaborate with UCSF a lot as well. So we get notification and updates monthly on what new trainings are being offered there, and just along with new ones being provided on a regular basis, department wide, and the regular on demand and previously recorded trainings available. Yeah, so attributes, I would say really showing up and the willingness to work with older adults, uh, being flexible with the challenges faced and asking for support when needed is going to be really key. And, working with others to problem solve. If there's an area that you might need more support in, talking with others and being able to just communicate about what areas you need support in. Being flexible to conduct therapy and support clients over the phone if they aren't feeling well, and just really figuring out solutions when clients have, you know, different types of barriers, whether that's language barriers, health complications, hearing or visual impairments, or other types of disabilities that we may have to sometimes get creative in figuring out how to best support the unique individuals that we work with. Yeah, I mean, you know, working in public health can be challenging in the sense of, there is a lack of resources available for older adults, and that can be challenging to navigate. Sometimes very specific resources that they might need, and I would say working in a stress system in general and managing the stress can be difficult at times and disheartening. But therein lies the challenge, also lies the reward, to help those who can't just walk away from the issues that they face. And I think providing that help to a vulnerable human in need, there is that sense of reward. I think that's why we do this type of work. Yeah, I mean, I think we're just really excited to be hosting interns at our clinic again. We have a designated space for interns to provide therapy. We're located in the outer Mission area with tons of residential street parking and great food options available nearby. We have a really homey clinic setting. We have, three bathrooms, a lobby waiting area, kitchen, group conference room, seven private offices, and other workstations available. So, just a little bit about how our clinic is set up. Also, when students are placed with behavioral health, civil service programs, they're also eligible to apply for our multicultural student stipend, which is always a great opportunity for students to consider doing placement with us here at DPH. And just an advantage overall for anyone looking to work with the city and county of San Francisco in the future, and getting an access and better understanding of the local city and county system, and access to our employment opportunities with great benefits and compensation that's very competitive in San Francisco. So I think it's a great opportunity.